How
Hmm.
do you open that dialogue when you disagree, but you want to have a respectful conversation?
Yeah, that's a good question. It's, I mean, I think you probably will feel uncomfortable. Like that's just part of the run of the mill when talking about something like that. I think like doing your best to connect with those underlying feelings of maybe not having a sense of control in the person's life. Like if they feel any sort of uncertainty about things or like might be struggling with something totally unrelated. Like trying to understand um, the root anxieties or like the kernel of truth for them that underlies a belief like that. For anti vaccine conspiracy theories, statistically, the demographics of the person most likely to believe in like some sort of anti vax conspiracy theory, that person's going to be a college educated woman.
Why
And
so?
the reason there
Interesting.
is kind of because of the kernel of truth. And the kernel of truth there is that women face a lot of inequities in healthcare, like disparities in healthcare. Women's pain management is often overlooked in healthcare settings. Women are not often, or they're not clinical test subjects as often as they should be when people are studying new drugs or new procedures or things like that. It's hard to get a diagnosis as a woman. And there's also like even a famous study where if a woman has a heart attack out in public, she's less likely to be helped than a man and if a man has a heart attack out in public. And that's not, and that's even if she's like presenting the classic signs of heart attack. So those things about women's experiences in healthcare are real, and can help explain why women are less likely to trust the medical establishment. And sometimes that tips over into anti vaccination conspiracy theories too. So sometimes there's a kernel of truth for people that's motivating them to gravitate to conspiracy theories.